There are many things pregnant women need to consider in terms of taking care of their bodies and their precious babies. But what are the most important prenatal care advice that they should be following? Hi everyone! This is Mommy Happy of Teach My Child, an online multi-platform dedicated to helping children maximize their potential. Before we dive in, please make sure to subscribe to our YouTube channel and like and follow us on Facebook, Twitter, and Instagram if you're looking for ways to unleash your child's potential. One of my favorite fashionistas is here, Dr. Kathryn Kooky Ongoco Perez. She's a graduate of the Obstetrics and Gynecology Residency Training at the Dr. Jesus Delgado Memorial Hospital, an active consultant at the same hospital, and a junior member of the Philippine Obstetrics and Gynecologic Society. She's here with us to discuss the top prenatal care advice. Hi, Doc Cookie.
Hi, attorney. I'm good. How are you?
Namiss kita, Doc. Ang galing-galing mo mag-DS. Kaya nga, nakita ko yung pictures niya sa Facebook. Ang ganda, Doc. You know, even with the PPE covered up, galing pa rin ang fashion sense, Doc.
Thank you.
Doc Cookie gave us a quick introduction to prenatal care in part 1 and debunked the most popular pregnancy myths in part 2. Now she'll be discussing her top prenatal care recommendations. Doc, what is the very first thing that pregnant women should be taking note of?
Okay. The moment that a woman learns that she is pregnant, she has to see her obstetrician. Okay? And ideally, usually naman, the first 3 months, as I said on the prior interviews, yung first 3 months of pregnancy, that's the most crucial part. Okay, so during the first 3 months of pregnancy, you are prescribed multivitamins, and there are ultrasounds that should be done. Okay, for me kasi I require 3 ultrasounds during the whole of pregnancy. One is during the first trimester, which is the transvaginal ultrasound. What is the transvaginal ultrasound for? Number 1, that is to properly age the baby. Because, you know, as women, diba, we have our regular menstruation every month. So sometimes, you know, women, mothers would say that my period is at this time of the month, but actually it's not. Because the period naman, it doesn't say that if you get your period on the 20th of February, on the 20th of March, you would have your period again. It's not really like that. Because there is a normal range of intervals. Okay. Mm-hmm. Second is the second one is during the second trimester of pregnancy, which is called the congenital anomaly scan. Okay, this one detects if they can see abnormalities on the brain, the spinal cord, the heart, okay, and other gross anomalies. The last one is the biophysical scoring. Okay, that is a surveillance to check if the baby is already mature enough to be delivered. So it checks the movement, the breathing, the tone, and also the amniotic fluid. Okay, during the first trimester of pregnancy, there are standards there. Okay, there are routine labs that should be done, like the CBC urinalysis, the HIV, the HEPA screen. Okay, and for us Filipinos talaga, we are actually what's this? By being just Filipino, parang we are at risk to having diabetes already. So it's dati kasi you only ask for the 75 OGTT during the second try. Pero ngayon it's okay na to do it on the first trimester. Okay, so and also during the first trimester, then that's the time that we're given the prenatal multivitamins, the iron supplements. So that is those are the things that we do.
Doc, you mentioned prenatal vitamins.
Yeah.
How about those who cannot afford to have these prenatal vitamins in their complete prenatal care? What can they do?
Okay. The prenatal multivitamins lang naman, they are there to supplement the daily recommended allowances during pregnancy. But for women who, let's just say, they really cannot afford, because sometimes it could be pricey. It could range from like 15 pesos to 30 pesos or even more one tablet or one capsule of vitamins. No, I think proper nutrition is enough. But syempre, when women are pregnant, they have an extra need for those supplements. But if you cannot, I think, kung talagang wala talaga, I think proper nutrition is okay.
Okay, going into nutrition, Doc. So you mentioned the prenatal vitamins only supplement the
Mm-hmm.
diet if the pregnant women are not able to adhere to the proper or to the required vitamins or nutrients that they should be taking during their pregnancy. So what exactly should the pregnant women be eating, or and conversely, what should they not be eating?
Okay, actually, I tell naman my patients that there's really nothing naman that you cannot eat except raw. Okay, like yung mga
Mm,
sushi, sashimi. I tell them to avoid that, but it's not really bawal. Well, if you can get it from reputable suppliers, it's okay. But as much as possible, I ask them to at least refrain na lang muna from eating raw food. But the rest, you can eat
mm,
anything, but all in moderation. Para to avoid, getting too big. But actually, wala.
mm.
Hindi naman siya. I do not ask except lang for the raw things. Yeah.
Doc, by any chance, do you recommend any of your patients to keep a food journal during their pregnancy?
I do if they are at risk, let's say yung mga high BMIs, yung
Mm-hmm.
matataas na yung BMIs kasi 'di ba as I said during the first interview, the weight gain of a pregnant woman depends on her BMI. So kung just to be on the normal side of kasi minsan hindi naman natin mapipigilan, really pregnant women really gains weight. Diba? But
Mm.
sometimes it's really hard to lose that after pregnancy. Kaya nga that's why proper nutrition is really it's really recommended for pregnant women.
Okay. Doc, can pregnant women work out?
Yes,
And if
yes,
ever,
of course.
what kinds of
Yes.
workout can they do?
Pregnant women can do very light cardio. They can do yoga. They can do Pilates. Pero there are programs naman for pregnant women. Yun nga, as I said, diba, there is the celebrity na I've seen na talagang even on the 8th or 9th month of pregnancy, super, super grabe yung niya. Nag-weights pa siya. But it's because, well, she said naman that, she had a clearance, go signal from her obstetrician, which is okay din naman. Kaya nga, but if you're really not, the yung type of woman, yung sporty talaga, if you do that talaga every day when you were not pregnant, it's okay to continue. But nga, as I said, siguro light cardio muna. Kasi yung iba, diba, there are people talaga that, parang hindi nila kayang no exercise in a day. Oh, but still, pwede naman. Hindi naman siya mahal.
Okay. Doc, you mentioned yoga. So is there any
Yeah.
truth to what I've been reading that yoga helps facilitate childbirth?
Well, pwede. Kasi may mga positions in yoga that could really open up your pelvis. Actually, not just yoga. There are exercises that can really open your pelvis to aid yung normal delivery, like squats. When you do squats, diba? When you're on the 9th month of pregnancy, diba, some would advise you do squats kasi to open up your pelvis.
Doc, I'm not sure kung ako lang ba yung minamalas or kung it's common that there are hormonal changes during pregnancy that
Yes,
causes acne and frizzy hair. Is that true, or ako lang ba, Doc, ang sadyang hindi pinagpala?
Yung acne kasi during pregnancy, we get some would get an increased androgen. That's a male hormone during pregnancy. So it makes you oilier. So meron mga nagbe-break out.
Okay. So, para sa mga katulad ko po, TMC viewers na, contrary to the usual na sinasabi nila na, oh, you're pregnant, you're blooming. Ayun, wag po tayo mag-worry kasi po, normal pala yun. Okay. Yes, Doc. Ayun. So, ang question ko dyan, Doc, is, So given that, we still want to take care of our bodies even while pregnant. Pero syempre natatakot tayo na baka mamaya yung tinitik natin ng medications for the acne or chemicals in the shampoo will harm the baby. So are there any chemicals that we should be avoiding, Doc?
Yeah, meron naman. Meron namang let's say for the skincare, you're not supposed to use yung mga retinoic acid. Kasi that can cause talaga a defect on the babies. But there are certain mga shampoos and all. Meron naman tayong mga organic ones that you can check. I think that nowadays marami ng mga organic and people are getting used to, are getting more aware of the benefits of using organics. So yun, pwede siya.
Okay. For those who are excited to have their babies and are keen to do all the things that they've been hearing about that can boost their baby's development, Doctor, can you recommend on how they can boost their kids' development?
Okay. Number one is you have to have a proper nutrition. Second, you have to regularly see your doctor. Third, supplements would be good to take and advisable also. But if not, it all boils down into proper nutrition.
What is the number one prenatal care advice that any pregnant woman should adhere to? Tipong kalimutan na nila lahat, or if they can only keep one thing in mind that they will do every day during their pregnancy, what would you recommend, Doc?
I would say it's proper nutrition. Kasi, let's say yung sa mga prenatal checkups with the doctor, let's just say you cannot afford. You cannot afford to go see a doctor. In the barangays, you can go to the local regular health center. They have midwives there that can check up your baby. Just but it does not replace, going to a doctor. But just in case really that we can't do anything if we cannot afford it. It's the health center. It's free. They give you advice. They give. I think even the midwives can. I think they have the Dopplers, or they can use stethoscope to check on the fetal heart tones. What else? And I think in the health center they can give you free vaccines for pregnant women. And sometimes I think they also give free prenatal supplements.
How can our viewers contact you for consultation?
Okay, patients can see me at Dr. Jesus Delgado Memorial Hospital. I am there every Tuesdays and Thursdays, 1 to 3 p.m. And during Wednesdays, Fridays, and Saturdays, I'm at Metro Antipolo Hospital and Medical Center. Wednesdays and Fridays, 1 to 3. Saturdays, 10 to 12. And in between those schedules, if I'm not in the hospital, I can be reached through telemedicine.
Thank you so much, Doc Kooky, for sharing with us your top prenatal tips. To our Teach My Child viewers, we hope you liked this video and the entire series. If you did, please give it a thumbs up, comment, and subscribe to our YouTube channel, and like and follow us on Facebook, Twitter, and Instagram. Thank you for watching, and we'll see you in our next video. Bye!